A lot of people don't realize this, but one of the most common mental health problems in elderly, those above 65, is not dementia, it's depression. 25% of people above 65 have depression. Most studies suggest that women suffer more depression than men do, but that's most often because men refuse to seek help. In fact, we know suicide among elderly men is on the rise. It's much more than in women. And the most common cause for suicide is depression. I think there are many factors that are thought to influence this, including for men that change in role and function that comes with aging actually is more, sort of devastating than compared to in women. Women can just move back to being that homemaker. Women tend to keep themselves busy, and men, find retirement really hard to cope with. Also, men find it hard to cope without their spouse. So a study has shown that 50% of men don't survive a year after losing a spouse. This is especially difficult among older men because there's a lot of pride, there's a lot of machoism, that's involved here. They're not going to come up and say, look, I have a mental problem, I need help. Because that pride prevents them. The stigma and the taboo of seeking help, it's not easy. But I think it's first creating more awareness and understanding that mental health problems are just the same as medical problems, and that it's very common as we age as well. Services need to be accessible. They need to be elder friendly. You have wheelchair ramps. You have and counter just for elderly. And, you even have maybe daycare where elderly men get together. Even if they don't have a mental health problem, they then develop supports in that, daycare center as well. Helplines, I think, are really useful and important. There are some countries that actually have helplines that cater specifically for men, because they know that, they feel uncomfortable maybe talking to certain people. And so, they have others who are trained to help them to talk about their emotions and feelings as well. So, I think if we reach out and help, in ways that, makes it more accessible, then we can actually help these people to seek help.
But if there's seniors already and they're not open to seeking mental health, then what about the younger generation? At what age should they, especially the men, at what age should they start preparing to be more receptive to probably getting help mentally?
Well, I think the more we are aware, mental health literacy will actually help this whole process of people being aware that our risk increase with age. And then we need to start working on, just mental health promotion, wellness programs. Even before we hit a mental illness, we should start learning on how to build our own mental health resilience. So I think if that starts at an early age, then we get more primed to think about mental health, and we'll be more willing to accept and seek help. Actually, obsessions are repetitive, irresistible, insensible thoughts that may or may not trigger compulsions. They eventually interfere with day-to-day functioning, and one of the top 10 disabling illnesses in the world. The pandemic may have caused us all to have repetitive thoughts and fears and compulsions of repeated washing and cleaning, but these are not insensible. That's what's been recommended by WHO, by our Ministry of Health. They are what's been advised, and so it's when it becomes out of control and we cannot stop the thoughts or actions, and it's interfering with our day-to-day life, that's when it becomes an illness. But to make a diagnosis of OCD or obsessive compulsive disorder, you need a minimum of 6 months of symptoms. So people may go through symptoms off and on. You have a little bit of a illness issue, some contagion in the family, or then you get into these OCD symptoms for a while, but then you overcome it. Similarly, what's going on with the pandemic, I think all of us are a little bit more OCD, but with time we'll get over it.
So it's just more an OC than an OCD.
Right? That's right. It's not a disorder yet.
Okay.
Right.
So if it's over 6 months and you're still feeling that obsessiveness about cleaning and germs, then it's probably time to seek help.
well, you need to also identify, is it becoming insensible? You just washed your hands and after 2 minutes you want to wash them again, you haven't touched anything?
Right.
That's a little
And a
insensible.
disorder would be, I don't want to go out of the house because I might pick up something.
Yeah.
Right, okay.
Yeah.
Well, one patient actually said this: the pandemic in general was a new experience for everybody, but for me, feeling anxiety and feeling uncomfortable wasn't new. So how can the treatment for the people with OCD sort of help the rest of us overcome these feelings of anxiety caused by this pandemic?
You know, some of my patients actually said the same thing, that, you know, maybe now everyone realizes what we go through.
Right.
And, you know, it's not so stigmatizing and prejudiced and all of that.
Which is great, right?
Yeah, yeah, I agree. I mean, treatment for OCD actually includes learning to live with anxiety. No one enjoys anxiety, but like it or not, during a pandemic, we all have to experience some amount of anxiety.
Yeah.
And learning to manage it and not looking at it as a threat, I think, is really important. So, you know, learn some of the other things that we teach people with OCD is to learn to deal with the unknown, and this is especially real in the pandemic as well. We can follow all the guidelines and SOPs, but we might still get sick, or, you know, so stop trying to be in control. I think that's what we often tell our OCD patients as well. Turn your focus from what you can do turn your focus to what you can do and let go of the rest. And finally, I think it's really important to be self-compassionate. In difficult times, we can have strong emotions and we can choose how to respond to them. But if we decide that we want to take care of ourselves, treat ourselves with kindness and respect, we end up, you know, being on top of it. There are many online tools that are used in mental health nowadays. I mean, we have numerous mental health apps and AI-modulated therapy sites. This, however, may be the first video game that's been approved by the FDA as a treatment for ADHD. It's prescribed by the doctor, so you can't just go and buy it from the shop or something. And the child needs to complete 5 missions in a allotted time. It's shown to improve attention span because it challenges the child to focus on multiple tasks at the same time. But it has to be used together with other therapies like medication, educational programs, family therapy, CBT. So, you know, it's not a standalone. It cannot just work on its own. In a video game, you typically have to immediately respond or else you lose.
Yeah.
And this attracts especially that age group, 8 to 12. They want to be competitive. So video games seem to hold the attention of kids with ADHD when they can't concentrate on the rest of their lives. But some researchers have shown that, you know, constant stimulation and instant rewards may make it harder for the kid to focus on normal, less stimulating situations.
Correct.
So whether this is going to translate into, you know, the rest of their life being, you know, focused and, you know, given the appropriate attention, I think that's yet to be seen.
Right. I mean, I'm thinking, wouldn't this cause another type of mental issue like addiction? Will these children later on get addicted to video games?
Yeah. So, well, because it's prescribed and it's fixed at 25 minutes per day, no longer, no more, this may actually prevent addiction.
Okay.
I mean, video games can trigger release of dopamine in the reward pathway like we discussed earlier. And yes, it can be addictive, but if it's controlled use, just like that 1 cup of coffee we have a day, that risk of addiction is much less. But, you know, there's a study done among 3,000 children and adolescents, and this was done in Singapore, that suggests that overuse of video games actually caused more attention problems and impulsivity. So, you know, I think maybe the controlled use is beneficial, but there's always a thin line between what's appropriate and what's not.